Imagine this: you're reaching for something on a high shelf, or maybe just swinging a golf club on a sunny day, when suddenly, a sharp pain flares up in your elbow. It stops you in your tracks, and you're left wondering, what just happened? Elbow joint pain is a common issue with multiple potential causes, from a simple overuse injury to something more complex like arthritis or even a bone fracture. But here's the thing: when your elbow hurts, it's hard to ignore, and it can disrupt your daily life in ways you never expected. In this video, we're going to dive into the major culprits behind elbow joint pain, break down their symptoms, and explore ways to manage and treat these conditions. Whether you're an athlete, a weekend warrior, or someone who simply wants to reach into the cupboard without wincing in pain, we're here to get to the bottom of it and help you find relief. Section 1: Understanding elbow joint pain. Elbow pain can sneak up on you, and it's often more than just a minor inconvenience. This pain could be a signal from your body that something isn't right. The causes can range from injuries to underlying conditions, and recognizing these can make all the difference in how you approach treatment. Symptoms of elbow joint pain: when your elbow joint is injured or affected by a condition, it often brings along a few other friends, like tenderness around the joint, swelling that may limit a range of motion, a burning sensation, especially in cases like tennis elbow, difficulty gripping objects or bending your arm fully. Identifying these symptoms and knowing what might be causing them is the first step toward finding relief. Section 2: Common causes of elbow pain. Let's break down some of the common conditions behind elbow joint pain, from the everyday strains to the more serious conditions. 1. Lateral epicondylitis, tennis elbow. What is it? This is a type of tendinitis that targets the outer tendons of the elbow. It's commonly associated with repetitive motions, which is why tennis players, chefs, and even auto workers are at higher risk. Symptoms: the pain usually feels like a burning sensation on the outside of the elbow. It might hurt to grip something firmly. Treatment: resting the elbow and using a brace can help reduce the strain. In more severe cases, physical therapy might be recommended to help strengthen the tendons over time. 2. Medial epicondylitis, golfer's elbow. What is it? Similar to tennis elbow, but this affects the inner tendons of the elbow, often resulting from activities like loaded gripping or wrist flexion. Think golfers, pitchers, and even carpenters. Symptoms: pain along the inner side of the elbow, and sometimes pain triggered by wrist movement. Treatment: rest and minimal intervention, along with ice and possibly wearing a brace to limit movement, are often effective. 3. Elbow sprains and strains. What is it? Sprains involve damage to the ligaments, which connect bones, while strains affect muscles and tendons. These injuries often occur from sudden twisting or bending of the elbow. Symptoms: pain, swelling, bruising, or even a popping sensation. Moving the elbow can be tough. Treatment: rest, ice, compression, and NSAIDs are common first steps. For more serious strains, surgery may be necessary to repair the ligaments. 4. Osteoarthritis of the elbow. What is it? Osteoarthritis involves the breakdown of cartilage, leading to pain and inflammation. Though less common in the elbow than other joints, it can still occur, especially from injury or genetics. Symptoms: swelling, stiffness, pain, and a limited range of motion. Treatment: exercise, anti-inflammatory medications, and reducing strain on the joint can help. In severe cases, surgery might be an option. 5. Olecranon bursitis. What is it? This condition affects the bursae, fluid-filled sacs that cushion the elbow. When inflamed, it can limit elbow movement and cause pain. Symptoms: pain, especially on the back of the elbow, and swelling. If it's infected, there may be redness and warmth. Treatment: rest, ice, and NSAIDs usually help. If an infection is involved, antibiotics may be required. In recurring cases, the bursa might need draining or even surgical removal. 6. Fractures. What is it? Fractures occur when one of the elbow bones breaks, often due to a fall, sports injury, or accident. Symptoms: severe pain, swelling, and difficulty moving the elbow. In some cases, you may feel tingling or numbness. Treatment: fractures often need a cast or splint. Sometimes, surgery is necessary to realign the bones. 7. Osteochondritis dissecans. What is it? A condition where a small piece of bone becomes loose in the joint. It might heal on its own or require intervention. Symptoms: pain, weakness, and a limited range of motion. Treatment: rest, avoiding physical activities, or surgery to remove the loose bone if symptoms persist. Section 3. At-home treatments and management. When elbow pain strikes, home remedies can often bring relief, especially for less severe injuries. Here are some common ways to manage elbow pain without needing a trip to the doctor. Hot and cold therapy. Ice reduces swelling, while heat can relax tense muscles and improve blood flow. Over-the-counter pain medications, NSAIDs like ibuprofen help with pain and inflammation. Topical creams, these can provide localized relief, especially for tendinitis. Stretching and strengthening exercises, improving flexibility and strength can help prevent future injuries. Braces and splints, assistive devices can reduce strain on the joint and support healing. For most people, these home remedies are enough to help manage elbow pain. However, if you're still in pain after a couple of weeks or if the pain is severe, it might be time to seek medical advice. Section 4. When to seek professional help. Elbow pain isn't something you have to live with, especially if it starts affecting your quality of life. Consider seeing a doctor if the pain is intense or sudden. There is significant swelling or bruising. You've experienced a trauma, like a fall or an impact. Pain doesn't improve with home remedies after 2 weeks. In a clinical setting, doctors can use X-rays or other imaging tests to understand the underlying cause of your pain. Treatments may range from physical therapy to surgery, depending on the severity of the condition. Conclusion: your elbow plays a crucial role in so many everyday movements. While it's easy to ignore mild pain, addressing these issues early on can prevent long-term damage and help you stay active. By understanding the potential causes and treatment options, you can take control of your elbow health and get back to doing the things you love. Remember, don't wait until the pain gets out of hand. Whether it's applying some ice, giving your arm a break, or visiting a professional, taking small steps now can make a big difference. Thank you for watching, and here's to the future with healthy, pain-free elbows.
You